I'm pleased to present Proarc Medical and invite CEO Gilad Hizkiyahu to join us.
Wow, what an audience, really. This is amazing. What a wonderful cast of Lady Sharks. It's a pleasure to be here. And I'd like to start this with a show of hands. If you're a man over 50, please raise your hand. Okay, keep it up, keep it up. And if you have a loved one, a husband or a father who's over 50, please raise your hands. Okay, that's pretty much almost everyone. So you know what all those men have in common, although they wouldn't admit it most of the time? Many of them wake up multiple times in the middle of the night with one thought in mind: to pee or not to pee. That is their question. And when this happens, this could be a symptom called enlarged prostate, one of the symptoms of enlarged prostate, or BPH. It significantly impacts quality of life. In fact, the prostate is a gland that sits below the bladder, and it constantly grows as men age and applies pressure that chokes the urethra, making it difficult to urinate. And that, when it happens, it's not that rare. In fact, 50% of men over 50 and 90% of men over 80. So there's a good chance most of us will experience this at some point. Now, naturally, the market for solutions for BPH is huge and it's constantly growing, just like the prostate. So companies that offer unique solutions that are adopted and approved by the FDA get acquired anywhere between $300 million and $1.1 billion. So let's see what those options are on the market. You go to a doctor, there are two basic options. One approach is resection or cutting the prostate, allowing urine to flow by removing the tissue. Those options lead to lasting relief, but associated with higher elevated risk for sexual dysfunction and other problems, and are irreversible. On the other side of the spectrum, we see mechanical solutions that offer retraction without damage to the tissue, just moving tissue aside using stents or sutures. Those offer minimal risk and are minimally invasive, but also short-term relief. So at the end of the day, you have to choose which one is more important to you, safety or durability. And at Proarc Medical, we think it's unfair to make such a choice. So we developed the Omega, the world's first implant to treat BPH. It's a unique solution using an implant that is robust, arc-shaped, and it enjoys the benefits of both worlds. It's a mechanical treatment, low risk, but also durable, leading to a long-term treatment. Finally, you don't have to compromise anymore when you perform those treatments. This is how it works. We insert our device to the center of the prostate. We pull back the cover. The implant is preloaded in the center. We inflate a balloon to retract the lobes. Then we create a small incision in the prostate and leave the implant inside. As you can see, it constantly applies pressure, mechanical pressure, to open up the prostate and stays inside unexposed to urine, which means it will last way, way longer than other solutions. Okay, so we're a proud Israeli company based in the north of Israel. Thank you. We're in the north of Israel, but our team of experts, our clinical advisory board, is comprised of expert US BPH, in fact, key opinion leaders of their field. We received multiple grants from the Israel Innovation Authority and the Horizon 2020 program, the European program. And I'm happy to say we just finished a successful pilot clinical study. We have 10 patients around the world with the implant in their prostate doing great. In fact, our results are exceeding our expectations and are surpassing other solutions on the market. So, we have a solid IP portfolio and we have a very well-defined reimbursement strategy to get to the market with the highest reimbursement potential of any other devices. Let's talk a little bit about the roadmap. So, we just finished our pilot study, as I mentioned, and we're progressing forward. This is the amazing investment opportunity I wanted to present before you today to support our company this year and help us complete our verification and validation processes required to achieve FDA approval to launch our big pivotal trial. Because next year, we're coming here, the US. We will launch our big FDA-guided pivotal trial, 200 to 250 patients around the US and Canada, 15 different sites. At the end of it, we will be able to secure our FDA clearance and launch the device to the market or get acquired at this point. So this is an amazing chance, an amazing opportunity to join us and help us enter the market and change people's lives today. With your support and our technology, we can make America pee again.
Thank you, Gilad. I want to ask our judges, as you proceed with the about what did you like about the presentation? What was good about it?
Are you saying we're not nice enough?
No, I did not say that. I said
Okay.
something else. What was good about that? One thing you liked.
I thought his actual presentation skills were incredible. I mean, you walked in confidence with yes. You were funny. You had like a beginning, like a hook. You had the people participating and raising their hand, and you closed with something funny that tied to the beginning. In terms of like presentation school, this is like top grade, A+.
I would add that we are region of female, and you maybe didn't expect
The right
that.
crowd.
You encourage to the crowd, like who can be related to this subject that okay.
I have an idea. We are females, but we have a crowd here of men. Something that I was curious, how many men here above 50 would feel comfortable in putting a product like this in their prostate? Can I see?
That's not a fair question, but
Wait. Okay, I'm just kidding. But no, seriously, one thing.
can I go with this?
I know.
Just if you're willing to go with the alternative and risk sexual dysfunction, raise your hand now. Thank you very much.
One thing along the lines that for me was missing was actually two things, but they're related. One of them is regarding the validation, how painful it is. Because the first thing I think about when someone tells me that there are no solutions or all the solutions are not good enough, then I ask myself why. This is already a yellow light. So, for example, serving and really understanding like how much people are willing to do. For example, for women, all women over 50 go to the bathroom several times a night. Like it's totally normal. We're totally used to it. And the other question I have is around the sales process. So I want to know who are the people that find this painful. Because in most cases, when you're a medical device company, you're actually not selling to the person that's in pain. You're actually selling to the doctors or the hospitals or the pharma companies. And then you have to believe, or you have to have validation that they have a pain, that they feel that this is a huge market, that they can make a lot of money from it, and that they need your product. They have a pain. So this is something that I would have wanted to learn more about.
Can I answer? Or time?
Briefly,
Just briefly. Level of pain, we have 10 patients with this procedure performed. After just 24 hours, they reported no pain at all or mild discomfort because we operate in an area that has very, very little nervous system, so it's almost painless compared to other solutions, so we're very surprised by that and happy to hear that. That's one. And as for the pain for physicians, so as you know, the market is driven by reimbursement, it's driven by profit, and that's why we teamed up with one of the world's expert reimbursement advisors that advised us to aim for a higher reimbursement level than any other devices on the market or in development that will increase the margin. And as for simplicity, this is a simple device, single implant, single use, very easy to learn. We call this in the industry see one, do one, teach one kind of device, and we receive very good feedback from physicians compared to other devices.
Okay.
I think one thing that's really important for people to say, I'm doing venture capital investments, and most of my investments are not in like medical devices or things that require FDA approval. I go for soft or like B2B enterprises, and I think when people look at those investments, they think, oh, it's all the same, and it's really not the same. The journey, they're both good, but good in a different way. And the world needs more medical devices and more medicine, but the journey is so long and dependent on so many approvals that you need a special type of investor who focus only on that.
Thank you.
Thank you very much. Give it up, everyone.